OrthoVirginia weekly segment here as we are joined now, Dr. Trevor Ottofaro. Doctor, thank you so much for taking some time out of your morning to chat with us.
Yeah, thanks for having me on.
Of course, it feels timely, feels very timely, right? You work with foot and ankles, and there is a notable ankle in the headlines right now with Bo Nix. And I know, of course, you don't work with him. You're not working with the Broncos, anything like that. But here today, just kind of providing your expertise. And I want to use Bo Nix as a jumping off point because we don't really know what exactly happened. We don't really know when it happened. We don't really know a lot about Bo Nix's ankle, but
Yeah,
he was able to play on it and seemingly finish out the game. Is that something normal we see with ankle injuries?
you certainly can, particularly these rotational ankle injuries and ankle fractures. They're along a spectrum. So, you can tear ligaments in that process, or in some case, if the rotational force is great enough, you can actually have a fracture and the ankle remains somewhat stable enough to continue playing on it. I mean, I think he's got obviously kudos to him for, sticking it out and still playing. That's pretty impressive. I don't know the exact injury, but oftentimes with just a distal fibula fracture or a syndesmotic injury, the ankle can remain stable enough, but still very painful, and they can continue playing and push forward. But obviously, in the long term, that's not going to suffice, and that's why we're seeing that he's probably going to be out and need surgery.
And I know with Bo Nix, he's had multiple ankle injuries to the same ankle. And just broadly speaking, when it comes to ankles, when you injure it one time, do you typically see a re-aggravation or a re-injury down the line of the same ankle?
Yeah, you certainly can. Not necessarily with ankle fractures, or hopefully not, but that's more the case with Bo Nix. But certainly with ankle instability, you can see it. You'll get an ankle sprain, you'll rehab it, think you feel fine, and you have some subtle instability after that, and you're more prone to turn the ankle again. And oftentimes that can lead to chronic ankle instability, which I see a lot of. And that's when you often have to consider surgery for these ligamentous ankle injuries, is with chronic re-aggravation and constantly spraining it and remaining unstable.
And kind of shifting focus a little bit to maybe more so the normal person or not necessarily a top end NFL athlete. How common are foot calluses and corns? What point do you recommend surgery for something along those lines that aren't a broken ankle per se?
Yeah, a little lower stakes. I mean, they're extremely common, and it all depends on symptoms. You've got a broad range from your athlete that just overuses the foot or doesn't have the proper footwear, to older individuals or folks even with diabetes that don't have great sensation and can overload a certain part and develop a corn or a callus. Not often do they require surgery. More often it's about correcting the orthotics or the inserts and offloading the area. You can certainly trim the callus or shave it, and then you have to really focus on offloading that area and correcting the biomechanical reason why you're overloading that one part of the foot. And so I very rarely operate on calluses unless there's like an open wound that develops, or something really abnormal, and particularly not usually in athletes. Usually we can get them with orthotics or inserts and get it offloaded and trim it and get it to calm down.
We had Dr. McGroarty on last week, and this brings me into turf toe because we talked at length about turf toe,
Uh-huh.
and that is something that is so intriguing to me when it comes to the foot because it is such a nondescript injury name like that.
Yeah.
We don't really know what it is. It feels like it's a catch-all for a lot of things. Can you explain to us again what turf toe is and why it is such an impactful injury for, in this case, NFL players?
Yeah, it's interesting because it doesn't really explain at all what it's specifically the big toe or the great toe, and there's that first MTP joint, and so it's basically where you sprain that because you have these little bones called the sesamoid under the first MTP, and when you're pushing off, which a lot of athletes have a ton of force going through when they're pushing off. It can actually sprain that sesamoid ligament complex at the bottom of the first MTP, and that can lead to instability and weakness with push off, which is very important for, obviously most athletes. And the reason why it's called turf toe is because, it's hard to say whether it wasn't described before then, but the rate of it goes up significantly with artificial turf. And then as people got faster and they started using more flexible cleats, that allowed the toe to bend more, which made it more prone to be injured. And so you see it more with flexible cleats and artificial turf. But usually we start off with treating that non-operatively and trying to get that ligamentous complex to scar in and be stable again. But the problem is that it can put you out longer than even an ankle sprain, because it's just a really hard area to heal, and it's such a tiny joint that sees so much force. Trying to get it back to 100% can be really difficult.
You mentioned something here, and I don't know if you have an opinion on it one way or another, but with the rise in artificial turf usage in the NFL at the high school level, at the recreational level, does that in turn cause a rise in injuries like turf toe, maybe Achilles tears, things of that sort? Do you see a rise in artificial turf also have a rise in injuries?
Yeah, I think it certainly has its downsides. It has its upsides. You certainly see things like turf toe. I think they've even looked at ACLs, which I don't deal with as much, but it certainly has its downsides, and that's one. You can have these injuries. It's just not as forgiving as grass, and so you're with these sharp cuts and sudden acceleration. You have not as much give and a ton of force going through these joints, and so I certainly think you can see more injuries with the artificial turf.
Gotcha. With it being the largest tendon in the body, kind of moving around to the Achilles tendon and seeing Achilles injuries, and for these athletes, when they do tear their Achilles or do something negative to their Achilles, it's something that keeps them out for such a long period of time. How does an Achilles injury impact the rest of the body?
Significantly, especially like you said, with it being the largest tendon in the body. And then the push off strength is huge. And so you lose that push off strength, your gait mechanics change. And then the big thing is the calf muscle really can atrophy quite quickly. And so without that push off strength, with calf muscle atrophy, even if you get to it quickly and repair it, you still have to protect the repair. And, getting that calf muscle strength back is key, and it takes a long time. And so it can certainly overload this same side knee, hip, and even lower back, and alter the gait mechanics significantly. And, I think we've seen plenty of examples with this. I mean, Kevin Durant took a while to get back. Kirk Cousins, I think, he wasn't playing like he was. You just don't have the push off strength. And that, I tell patients, even professional athletes can take 9 to 12 months, sometimes longer, to get their strength back. And you sometimes don't gain it all back. There's a little side to side difference, even with a good repair. And so it's a important thing not to overlook and to counsel patients on.
Yeah, that's a great point on Kirk Cousins, because even Aaron Rodgers, you see a lot of these star quarterbacks, they come back that first year, they're still definitely suffering from some of the side effects of the surgery. Like we always in fantasy football, at least when I'm trying to identify which quarterbacks I'm going after, it's always the year after when it comes to Achilles, ACLs, things of that sort, because it just takes that amount of time, it seems, from a professional standpoint to kind of rebound and get back to as close to 100% as possible.
Yeah. I mean, and you're talking about some of the most elite athletes. And so even the most minor things can make a huge difference.
So you're telling me the pickleball athletes aren't elite level athletes that are coming in?
Considering my patient population, I would never disparage pickleball. No.
Oh, of course. I love
elite
pickleball.
Athletes in their own right.
Yeah, 1000%. Look, I've gotten into some aggressive pickleball matches. My girlfriend and I were in a league. We made it to the championship, and I don't think I've sweat and fallen on a court as much as I did in the championship match, in a losing effort, I might add.
Oh, well, I mean, hey, that still counts. Congrats. I've injured myself playing pickleball too. It was in flip flops on the beach, and then decided to play pickleball and just jammed all of my. It's a dangerous sport. All right, I'll give it credit.
1000%. Look, I'm not used to that explosive energy being used on a play in play out basis. Going back to Achilles with pickleball, that could potentially be something you injure. How do you go about repairing an Achilles? Is surgery always necessary? Are there non-surgery routes? How do you go about repairing an Achilles tendon?
Yeah, I mean, I I think there's always a non-surgical route in a certain patient population. For folks who need that push-off strength, that's the big thing I counsel them on. So folks over a certain age who just want to walk around the neighborhood, for example, and let's say they got an Achilles injury, it may not be as important for them. But even older folks who want to go out and play pickball and are reliant on that push-off strength are more likely to benefit from the repair. It was probably about 10 or 15 years ago. There's some literature that came out and said, oh, you could non-op Achilles injuries, and they do just as well with this functional rehab protocol. And, they do fairly well. But I think the thing that you notice, and particularly when you're considering somebody who's like an elite athlete or very active, is that they lose the push-off strength. And so that's really what I counsel them on and try to decipher from talking with them, what is their activity level? What do they like to do? Because if they're going to if they want to do running, explosive sports, I need to figure that out because I think they may do better with a repair.
That makes total sense. What's kind of your role throughout the entire process from pre-surgery, surgery to post-surgery?
Yeah. So, pre-surgery, the big thing is diagnosing and then giving them, I think, all their options. You're not going to force anyone to have surgery, obviously, and you got to give them a clear picture of, hey, these are the risks of surgery, because even the most simple surgery has its own risk factors, and here's what you can expect your recovery to look like. Here's the benefits of doing the surgery and what I expect, how it can help you. Here's the option for non-operative treatment, and these are the downsides of that. And then I make my recommendation. I think you like to run or you like to play pickleball. I think you could benefit from an Achilles tendon repair, for example, because I feel like if we do non-operative treatment, you'll have decreased push-off strength. And so it's going through that and kind of making sure they have a bird's eye view of everything I'm thinking about and what their options are. And then, obviously there's doing the surgery, making sure they're medically fit for the surgery, performing it. And then post-op, I see them back usually 2 weeks, 6 weeks, 12 weeks, and just really closely monitoring, one, are the incisions healing, dictating their weight bearing status, deciding when they can put weight on it, when we can start strengthening it, and then even return to sport or return to activities, and I work closely with the physical therapist with that, obviously, and making sure that they're making gains there, their gait's starting to normalize, and then we can start working on, hey, let's start working on some explosive activities, plyometrics, things like that.
And where can listeners go if they want to schedule an appointment with you guys at OrthoVirginia?
Yeah, they can just go to orthovirginia.com, and they've got all the providers, including myself there, and schedule online.
Awesome. I really appreciate the time. Thank you so much for the insights throughout, and have a great rest of your day.
Thanks. You too.